I'd like to call the what is today? 28th? March 28th Human Resource Meeting for the Broward Health, the North Broward Hospital District to order. We'll start with a roll call, if we can get...
Yes, Commissioner. Commissioner Wellens?
Here.
Commissioner Rodriguez? Commissioner Uri?
Here.
Okay, let's see.
Okay, we have...
Oh, I'm sorry. Oh, they're not. You just missed that, right? Sorry. It was you.
We have a small agenda item, and we have one addition to the agenda today. We received notification that Rocky Rodriguez has resigned his position as commissioner on the North Broward Hospital District. On behalf of all the Board of Commissioners, I would personally like to thank Rocky for his leadership, his dedication, and his contributions through the years. I'm sure we will have further discussions at the board later today, but I thought in light of this meeting and him being part of this committee, and that we should announce that here at this time. So we'll talk more about it later today. Thank you. Are there any public comments?
Not at this time, Commissioner.
Thank you. I'm going to ask for, which I don't see here, I'll have it, approval of the meeting minutes from the HR committee meeting that we had last week. Why is that on here? Shouldn't that be on our regular board agenda?
On there.
Yeah, we don't need to approve them here.
They're going to the board.
Yeah, that's right. I don't know why they're on here. Okay, I'm sorry. So we only have one item on the topic of discussion for today, and that's the President CEO contract approval and recommendation to put it on the board for consent agenda. So with that, I'm going to turn it over to the Vice President of Human Resources, Senior Vice President Peter, if you want to take over and introduce your work that you and Commissioner Klein did.
Okay, absolutely. Thank you so much, board members. At the January board meeting, Ms. Capasso was selected as the president and CEO for Broward Health. Board chair Rocky Rodriguez assigned contract responsibility to Commissioner Andrew Klein due to his role as board treasurer. Market survey data was obtained, and in addition, a review of salaries at similarly situated local public health systems such as Jackson Health System and Memorial Healthcare System was done. The market's base salary recommendation for President CEO for Broward Health is $852,813. So $852,813. A draft contract was prepared based on the district's form agreement, not unlike that used for previous CEOs at the district. At the request of Commissioner Klein, outside counsel also reviewed the draft contract. I am pleased to announce that Ms. Capasso has agreed to take more than $100,000 less than the recommended FMV salary. Ms. Capasso's proposed salary will be $750,000, effective retroactive to January 31st, 2018. For comparison, Aurelio Fernandez, President CEO of Memorial Healthcare System, accepted a base salary of $790,760 in July of 2016. Carlos Migoya, who's the CEO and President at Jackson Health System, accepted a $730,000 base salary with performance bonuses of greater than 50% in May of 2017. Ms. Capasso's performance review shall be conducted by the board annually. Ms. Capasso will also be eligible for the management incentive plan as it is being proposed for senior leadership employees. In addition, Ms. Capasso has the potential to earn an additional 20% annual incentive bonus for the effective improvement of Broward Health's compliance program in compliance with the CIA for each reporting period, as defined in the district's corporate integrity agreement. So that's the summary. I think you each have the draft contract.
So I'm going to ask you a question, Peter. When you take Ms. Capasso's base salary plus incentive compensation, where does that place her compensation relative to our closest peers, Jackson and Memorial, in a dollar or percentage basis?
It will be, she's still less than the 50th percentile, and her total package is less than both the Jackson CEO and the Memorial Healthcare System CEO.
And if I'm reading this correctly, her proposed maximum short-term incentive is still below Memorial and Jackson, right? So we're not paying her in any way, whether it's base salary or incentive comp is still below what our competitors are, right? So it's okay.
That is absolutely correct.
All right, and the 20% bonus is paid, it's annual, achieving certain targets related to the CIA, and that's paid at the end of the year after we...
Yeah, it's paid after the conclusion of, once the year concludes for the CIA.
Okay, perfect. All right, and she's, I have no more questions about it. Any?
Just one.
Sure.
How does that compare with some of the private competitive hospitals like Tenet, HCA?
Much, much lower.
Much lower.
Yes. The base salaries of a competitor like, say, Baptist, it's much, what is it? Yeah, it's above $1 million.
Thank you.
One of my, I guess, areas of focus here as it relates principally to the incentive comp. Peter is trying to understand what financial metrics are either referred, I don't believe there's any, in fact, I'm certain there's none as it relates to CIA, but in terms of the strategic plan, the objective metrics, okay, namely financial ones, and in particular honing in on our public support.
Say that
Our public support, in other words, tax revenues that the system receives. I want to understand how the incentive portion of the compensation plan is influenced by meeting certain financial metrics and whether or not those financial metrics are consistent with reducing the burden on taxpayers.
Yes, Commissioner Uri, and we'll talk further about the management incentive plan at the board meeting when that specific item goes to the board. So Bev's contract, basically, whatever is approved by the board for the management is going to, that she'll be a part of that group. Now, to your point, the first trigger for getting a management bonus is that the organization must meet the financial requirements that will pay at 100% for those incentives. So, and this is really a methodology for executives where their base pay it doesn't really fulfill the entire or represent the entire salary. It's only a portion of the value of that particular position. The other portion is filled in based on your capacity to drive the results of an organization. So the better your organization does, then the higher your incentive payment will go. So if as an example, we used a 30% annual incentive, that it's up to that point. So it could be 10, it could be nothing, it could be 30% based on the organization's performance, not only just on financial, which kicks in the money, but also on quality, safety, and people metrics as well. As the organization gets better in those areas, then
Right.
the better.
No, I understand that. What I'm just trying to understand, and because we're being asked in this committee
Yes.
to recommend the board approval, right? I'm assuming that's what this discussion's about. So I'm just trying to understand as it relates to the financial metrics. In other words, and maybe Alan, if you want to jump in, I just want to understand that in order for any bonus to be paid, there's to anyone, including Ms. Capasso, at least anyone that is part of this pool,
Yes.
what metrics need to be hit, and how does that relate to taxpayer support? In other words, my presumption would be that a better performing operation, a better financial performance means most likely reduced public support. In other words, the
You're
public
absolutely-
is benefiting, not obviously just management, and that's what I want to see.
Right, the how we're going to do the incentive plan, if it gets approved by the board later today, would be the Board of Commissioners, as I would present a budget to you guys with, if we set the millage rate. So if you guys say, you know, I think that you guys have turned the ship and I think you can reduce the millage rate, you know, $10 million, $5 million, whatever you guys decide to reduce the millage rate on, the incentive plan, we need to achieve that budget plus have money as a gain share to pay for the bonus. So if, for example, if we just achieve the budget and there's no surplus left over, there wouldn't be any bonus. If we achieve $10 million of the surplus, then that money would be divvied up by the 30% that we're talking about. So it's really, you know, the financial trigger sets it off. Then we decided, okay, financial is not good enough. Quality, people, everything else that's in a balanced scorecard that is community standard and competitively standard and market standard throughout every healthcare. I think 88% of the healthcare organizations out there. You then have to hit those targets. So even though it says up to 30%, the way I look at it is if we're hitting the 30%, that's good for the community,
Right.
That's good for the patients, that's good for everybody, because that means that everything that our objectives that we set out to do, we're achieving them, and we're providing good quality, we're taking care of our people, we've hit our financial targets. That's what the additional comp is, and what I think, you know, what our managers are doing, and what I think Bev is trying to do is she's betting on herself and saying that we have the ability to, I'll take less pay, but I'm willing to take less pay because I know that I can hit those objectives, and that's where that 30% comes out from.
Yeah, I think it's, Chris, I think
understand
it's
it.
two different discussions, though. You know, the 30% potential incentive comp is only if a separate incentive plan is approved at the board. That's not
I understand.
part of her contract. The incentive comp is in her contract, the bonus structure is in her, is it going to designed to achieving targets dealing with compliance in the CIA. So I think we want to keep those two issues separately, but I think the presentation we're going to give you, or hopefully Peter's going to be giving us, related to the management incentive comp will better lay that out, of how the incentive comp is going to work, what the metrics and the scorecard is going to mean. It's going to take some time to get that together. But at the end of the day, if we achieve the financial targets, we achieve the quality targets, we achieve the safety targets, we achieve the people target, meaning our employee satisfaction, you know, keeping people in place, that means we have a highly functioning district, a highly functioning group of hospitals, and hopefully that leads to a less reliance on taxpayer dollars, because I don't think there's anybody on this board that doesn't want to reduce the millage every single year that we can going forward. I'd love it to be zero. So you know, I certainly wouldn't allow for metrics to allow for us to achieve those targets using taxes. So tax dollars. I think we need to go on a focus of reducing the millage over time, but achieve all of the incentives that we want. If we do that, I think the district will be functioning properly. But I think they're two different issues right now.
Well, I don't disagree that they're two different votes. I don't know necessarily that it's two different issues. We were presented, obviously, with here's the base and here's the maximum and so on. So in comparison, I just want to be on a record then for, as it relates to any incentive compensation pool, one of the key focuses for me is going to be the financial metric of reducing the taxpayer support. And I don't mean support other than financial support. I know they're there to backstop this organization and in recognition for the wonderful service that this organization does to the community in terms of uncompensated and other care. But in terms of incentivizing our management team, and the only person of the management team that I believe we're referring to, that would have direct control over these types of things is our CEO. That's the only person that reports to us in that group. And so from my perspective, I just want to make sure that everyone understands that that's the direction we need to be focused on in terms of these financial metrics. I'm confident that we are. I just want to make sure that between the conversations that we have had both in this committee and in any other meetings, that's not lost between now and whatever gets put in place. And I want to be on record with that. So
100%. I think
okay.
financials drive a lot of ability to utilize resources for all the things that we want to do. So if the financials aren't there, they're not going to hit the management incentive comp. So it's not guaranteed that that's going to happen. That's only if we achieve it. I think financials is one of 4 targets, and it's certainly important. But I don't think you get to the other targets if you can't achieve the financial targets. It means we're not functioning like we should.
Agreed.
Yeah. So I think we're all on board there.
Or you don't obviously want to be hitting the financial targets because you're, skimping on quality,
Well,
care.
again, the incentive comp doesn't
You don't
get
want to have
paid.
those things
Right.
incentivized either. So I totally.
Yeah, I mean, if it meant that we were hitting financial targets because we were skipping all other things, we're not going to hit the metrics on the service and the quality and the people. So therefore, no one's going to get paid. The idea is to tie the ultimate performance of the district and all of its entities and all individuals' performance, tie that all together and reward people for exceptional performance, but not on an individual basis here, on a global basis across the district. So we may have one highly functioning facility, but the others don't pull their weight. No one gets paid. So everybody's in the same boat here, and I think that's a much better position to be in, is when you have a complete management team of 300 professionals focused on achieving results across the system. If they can achieve those results, they deserve to get paid. Everybody that works below them is going to get paid. There's going to be more money for all the different buckets, and I think everybody's going to be more successful. And so we as an organization will be successful. So I certainly would support you in that.
Right.
Those are important metrics.
Let's also not lose sight of, and I don't want to jump ahead here, but let's not lose sight of the fact that Ms. Capasso's role here obviously has a sunset.
Correct.
Okay, and so whatever is done, whatever is put in place by this board or, a future board between now and that sunset is also sending a message to the marketplace for whomever it is ultimately takes over the reins. And I think we just need to be mindful of that and make certain that whatever we're doing isn't too near-term focused and sends the right message in terms of recruiting folks. So
Yeah, and if I'm not mistaken, this contract is for a 3-year term or the exit of the CIA.
That is correct.
But if we exit the CIA earlier than 3 years, it's still for the 3-year term. But at the end of 3 years, if we haven't exited the CIA, the contract still terminates, right? Is that the way I read this?
I need to look at that.
It's 36 calendar months or 2 upon the final release of the corporate integrity agreement with the OIG. Whichever's later.
Right.
So So it's 3 years or the OIG?
It's basically a minimum of 3 years.
Correct, okay. And at the end of 3 years, if we're not out of the CIA, but we'd have to go back and negotiate within 90 days prior to the end of that term, is that correct?
Within 60 days, I believe.
It says to negotiate within 90 days, I thought.
Hold on, let me see.
I think on page 2 it says, oh no, we have to notify her. I just want to make sure that everybody's clear on the terms of, that this is a 36-month contract for exiting CIA, whichever's
Later.
right.
It's really just to, I'm assuming, I wasn't part of the negotiation, but I'm assuming it's reflecting on the fact that we may not exactly be in control of when
Correct.
we're released from the obligations under the CIA. In terms of
Not
time.
being a member of this committee, I can still participate in the discussion. I just could not vote, okay. So that's right, I mean, and that's why I wanted to attend the meeting. So the way this is structured is a 3-year period or release from the corporate integrity agreement, whichever is later. And then, consistent with typical employment contracts, there are severance provisions for, either party's option depending on certain circumstances, such as for cause or certain contingencies. And as noted, we did have outside employment counsel take a look at the agreement, and they were comfortable with it. So I wanted to make sure that we were proceeding, appropriately, obviously for an important contract such as this nature.
I don't have any more questions. Anybody else have any more questions? So my question to the general counsel is, now there's 2 people on this committee, right?
Yes,
There's no quorum requirement. That's a majority anyways of 3.
and the quorum is 2.
Correct, quorum is 2.
Right.
Okay. So I guess I would ask for a,
I think that would be me, right?
Right.
that would be you, but a week,
I'll move that this committee recommend to the board approval of the contract as presented between the district and Ms. Capasso.
as a consent item?
I think it's best that it be a discussion item, right? Unless, my recommendation would be that it be a discussion item.
I'm sorry, I didn't hear.
I'm just trying to clarify. I think is right. I think, just restate your amendment so we have it clear on this.
I'm not amending anything.
I mean, you're,
What I'm saying is I move that this committee recommend to the board approval of the contract as presented between the district and Ms. Capasso.
okay. I guess I second it. All those in favor say aye. We say aye.
It's a little goofy. I agree.
Okay, so motion passes, recommendation go to the board for discussion of the board and approval of the full board.
And I'll move to adjourn. Unless there's other business that's somehow not on the agenda.
This meeting's adjourned. Thank you.